Hello, my dear audience. Welcome back to the Applied Behavior Analysis Simplified channel. Today, we're going to dive into the topic of punishment, why people choose to utilize punishment in ABA, and if it is allowed. Thank you for watching and supporting the channel. Quick reminder, if you're new to the channel, welcome and thank you for being here. Please watch the channel trailer to acquaint yourself with the content in this channel. Just a quick reminder, watch the short videos from the beginning if you are preparing for an RBT exam for certification. I created a playlist specifically for this. Understand the basics to be able to understand the complex information. As always, at the end of this video, I will reveal the topic for the next video. Stay tuned. Punishment. Why is punishment utilized in ABA? Well, understand that punishment in the field of ABA occurs after a behavior and reduces the future occurrence of that behavior. Punishment is very common in everyday life as well. For instance, I gave my daughter sushi for dinner. She told me that she did not like it and she did not want to finish her meal. I never gave her sushi after that. In this example, she punished my behavior because I never again gave her sushi to eat, which means that my future occurrence of giving her sushi decreased. Information comes from Barb and Eldori 2024, except for examples which are made up. An example in the medical setting would be taking away a reinforcing object if the problem behavior occurs. For instance, if a child screams when she is asked to complete a task, the iPad, which is the reinforcer for that child, can be taken away. It is important to understand how and when a punishment procedure can occur in the field of ABA. It is only ethically possible to use punishment if all the procedures, including reinforcement, did not give positive results, and if the client and the stakeholders give their consent that they agree for the punishment procedure to occur. If there is a possibility for the client to give consent, then the client does give their assent, actually, not consent, to the therapist for the punishment to be utilized. If the client is nonverbal, in those cases, parents or other stakeholders are the ones who give their consent. Information comes from Barb and Eldori 2024. It is only ethically correct to utilize punishment when the problem behavior might cause harm to a child and or others. An example of that would be if a child has a sensory behavior and bites themselves. The bites occur often and can damage the skin, and if the behavior maintains, the child might start biting others as well. This can harm the child and others if the behavior maintains and generalizes to other people. To help this occurrence, utilizing punishment as a form of procedure, it is vital because it can reduce the biting, decrease harm to self and others. However, if it can ethically be done only if the however it can ethically be done only if the stakeholders, meaning parents or caretakers and etc., consent to treatment with a punishment procedure. Again, information comes from Barb and Eldori 2024. It is also advisable to utilize punishment with a reinforcement procedure, in which an alternative behavior will be reinforced. Punishment alone is not something that is advisable to be utilized in ABA. If the procedure can reduce self-harm and harm to others and all ethical codes are followed, then and only then a specialist in the ABA field can and should utilize punishment, considering Behavior Analyst Certification Board ethical codes. Next topic will be generalization. Again, the information comes from the same source. Here is the reference list. Thank you for watching.